Good day. I am Dr. Yen Reyes. I'm a pediatric infectious diseases specialist, and I'm an assistant professor of the University of Santo Tomas Faculty of Medicine and Surgery. I also chair the Infection Prevention and Control of South Imus Specialist Medical Center Imus, and Dasmariñas City Medical Center. As of today, March 29, 2021, 10,116 cases were reported. Most of the time, punong-puno na yung mga hospitals. Puno na yung ICU, puno na yung mga wards because of the COVID cases. So, yung mga mild and asymptomatic cases, sa home care na lang ang gagamitin natin. So, napakadaming nagtatanong, so ano po ba yung gagawin pag nasa house lang sila tapos may COVID naman? So, pag napapansin nyo dito, pag may moderate, severe, or critical admitted, pero kung asymptomatic naman or mga mild yung symptoms, home care na lang sila. So, ano yung difference ng isolation and quarantine? So, isolation is separation of sick people with a contagious disease from people who are not sick. So, for example, kung ikaw mismo ang may COVID, isolation ang dapat mong gawin. Quarantine naman is separation and movement restrictions of people who were exposed to a contagious disease to see if they become sick. So, yung mga na-expose sa'yo, sila yung magka-quarantine. So, saan yung mga isolation places ng Philippines? Pwede kang mag-self-isolation, which is strict isolation of a suspect, probable, or confirmed case with mild symptoms in a separate room or an area in the household. So, home isolation lang. Meron din tayong tinatawag na Temporary Treatment and Monitoring Facility or TTMF. It is also known as Megaligtas COVID Center. Meron din tayong Community Isolation Unit or CIU. Meron ding Local Isolation and General Treatment Areas for COVID-19 cases. Ito yung tinatawag na Ligtas COVID Center, which is a community-managed facility in a barangay or municipality. So who are the close contacts? So yung mga individuals who experienced any of the following. Exposures 2 days before and 14 days after the onset of symptoms. So kung na-expose kayo 2 days before, close contact na yon. Even after 14 days na may symptoms yung person na may COVID. So kung sino din yung nag-face-to-face contact within 1 meter and for at least 15 minutes, may direct physical contact or direct contact with an infectious secretions. Like for example, ikaw yung naglilinis ng mga linens or yung mga pupo ng mga bata na may COVID, yun, may direct physical contact ka. Or meron kang direct care for a patient with probable or confirmed COVID-19 disease without using the recommended personal protective equipment. So what home isolation measures should be observed? First, number 1, isolate to contain or prevent the virus within the household and community. So dapat mag-isolate ka. Stay at home. So as much as possible, magwe-wear pa rin ng mask at saka magwe-wear pa rin ng face shield. There should be a well-ventilated single room. So open windows if possible. And ideally, dapat may solo bathroom kung pwede. Meals should be taken inside the room. So, ibibigay nyo lang yung food niya sa labas ng door, tapos siya na lang yung kukuha. Then, have your own trash bag in the bedroom. Dapat may trash can and close completely before disposal. So, yung trash can dapat completely closed. Avoid using fans unless there are no other individuals in the room. Kasi yung fan, lalong kumakalat yung virus, especially pag may tao naman sa loob na nagpunta sa'yo to get your linens, so put off the electric fan. Assign only one person as primary caretaker. Like for example, kung ang bata merong COVID, so yung mother lang, so dapat one person lang para hindi naman lahat may expose. And maintain a distance of 1 meter. So, daily monitoring, ano dapat gawin? Temperature monitoring 2 times a day, isa sa umaga, isa sa hapon. As much as possible, yung mag-pulse ox kayo para ma-check yung oxygenation. Nilalagay lang naman yun dito sa index finger, so para ma-check yung oxygenation mo. So, anong pa yung home quarantine measures na gagawin mo? So, frequently clean hands with soap and water or alcohol rub, especially kung may contact with any ill persons or their surroundings. Important then, before, during, and after preparing the food. Kahit pagkatapos, dapat mag-wash ka rin ng hands mo. Before eating, and especially after using the toilet. Use dedicated dishes, cups, and eating utensils. So yung merong may COVID, solo lang niya yung kanyang plates niya, cups, and as much as possible, disposable sana para itapon lang agad. Pero kung wala namang disposable, dedicated utensils na lang. So solo niya yung fork and spoon and plates niya. At saka towels and bed linen, solo niya yun. No sharing. So you wash the dishes, eating utensils, towels, or bed linens used by the ill person with soap and water. So when coughing and sneezing, cover mouth and nose with a flexed elbow. Especially sa case, tinuturo namin ganito sa ubo para hindi masyadong kukalat. And if you are experiencing difficulty of breathing, call the health facility immediately. So disinfection. So disinfect mo yung high-touch objects lagi. Alcohol or Clorox, you have to clean the doorknobs and the light switch and mga tables. At saka yung dining table na kinakainan mo. Tsaka use alcohol or Clorox to clean those things. So the toilet should be flushed with lid down. So dapat naka-cover yung cover ng toilet bowl to prevent the droplet splatter and aerosol cloud. For the laundry, do not shake the dirty laundry. So ilalagay mo siya dapat sa plastic, tapos bawal siyang i-shake. Tapos machine washing with warm water and laundry detergent. So as much as possible, warm water yung gagamitin. Kung wala namang washing machine, pwede siyang gagamit ng pail, pero isusok mo siya ng 0.05% chlorine for approximately 30 minutes. Or 1 tablespoon chlorine in 1 gallon of water, tapos isok mo siya, i-stir mo yung kuha ka ng stick para maano siya, tapos wash in warm water and detergent. So pagkatapos dyan, you can sun dry the clothes. So you have to use also a lined trash can. So dapat may cover siya na plastic para doon mo didiretso itapon yung mga mask, mga gloves, or tissues, or other contaminated items. Tapos when you throw it, dapat naka-cover lahat yung naka-cover. So dapat i-close mo yung plastic na yon before throwing it. And use gloves when removing the garbage, bags, and handling and disposing of trash. So home nebulization. It should be avoided unless the physician decides that it is indicated. So as much as possible, bawal yung home nebulization. Kasi, isa siya sa mga tinatawag na aerosol generating procedure. So magpo-form siya ng aerosol. So instead of by droplet transmission yung COVID, matatransmit siya tuloy through airborne route. So bawal yung nebulization. So you can use a metered dose inhaler if necessary. So your physician naman will prescribe to you yung metered dose inhaler. Steam inhalation. So it is ineffective. Yung tuog, hindi siya effective in treating and preventing COVID-19. In addition, it has been found to be associated with scalp burns. So uso to sa Philippines, so we just want you to know that it is ineffective. So you can also download this form from the Pediatric Infectious Disease Society of the Philippines website. So pwede itong form na to para sa daily monitoring. So mag-checklist kayo. So you'll get your temperature in the morning and in the afternoon. Tapos check mo kung may fever ka ba, may cough, may sore throat, difficulty of breathing, runny nose, diarrhea, vomiting, abdominal pain, yung masakit yung tiyan, fatigue, yung pagod na pagod ka, headache, sakit ng ulo, muscle pains or body malaise, yung ang sakit ng katawan mo, yung para kang may trangkaso. Other symptoms, yung anosmia, wala kang pang-amoy, o kaya agwesya, wala kang panlasa. So, i-checklist mo yan and tapos report to your doctor. So, as much as possible, kung naka-home care ka, you can do telemedicine. So, like for example, ako, marami na rin akong patients, basta daily telemedicine lang sila. Most of the time, gumagaling naman sila. Without being admitted. Napakarami nang hindi na-admit. Telemedicine lang, report lang na sila ng report sa akin ng mga symptoms nila. Tapos, most of them naman, gumagaling naman. So, what home remedies can be advised? So, symptomatic treatment is recommended. Dapat may balanced diet. So, eat kayo ng proper fruits and vegetables. Tapos, dapat meron kayong protein, may carbohydrates, tapos fruits and vegetables. So, proper nutrition as well as adequate hydration. So mga 8 glasses of water per day or as much as possible kung kaya nyo ng water therapy, increase na water. Wala naman siyang overdose. So antipyretics may be given for fever and pain. So paracetamol, pwede nyo siyang ibigay tuwing may fever lang. And essential vitamins and minerals like vitamin C, vitamin D, and zinc may help boost the immune system. So pwede kayong mag-inom ng vitamins. So aside from that, bed rest din. So rest kayo ng rest kasi most of the time yung complaints ng mga patients ko, ang sakit-sakit ng katawan nila, para talagang may trangkaso. So bed rest ng bed rest, tapos balanced diet and proper nutrition and adequate hydration. Most of them, nagiging okay naman even with home care lang. So when to seek medical emergency attention. So ito yung mga warning signs na kailangan i-contact nyo agad yung doctor nyo or diretso na kayo sa emergency room. Difficulty of breathing, nahirapan ng huminga, seizure, nagkukonvulsyon na, or changes in sensorium, nagde-delirium na, kung ano-ano nang sinasabi. Yung nakakakita na sila ng angel, mga ganon. Pag mga ganon, nagde-delirium niya sila, changes in sensorium, diretso sa emergency room. Progressive abdominal pain, yung sobrang sakit na yung tiyan. Persistent diarrhea or tae ng tae, vomiting, or poor oral intake and signs of dehydration. So pag dehydrated na, diretso sa emergency room, kailangan na ma-dextrose yun. Fever and progressing rash in a highly irritable child, pag sobrang irritable na yung bata. Or there is worsening of symptoms or non-improvement in 2 to 3 days. So pag gumagrabe na yung mga simptomas na nasa checklist, dapat mag-consult na kayo sa doctor niyo. Pero as much as possible, do telemedicine at least daily with your doctor and report whatever symptoms you have para mas kampante kayo. So when can a patient with mild COVID be integrated in the community? So kailan sila makiklear? So this is from the DOH Administrative Order Guidelines. Pag mild lang yung symptoms na nila and they completed at least 10 days of isolation from the onset of illness. So 10 days na complete nila and 3 days of being clinically recovered and asymptomatic. So wala na siyang symptoms for 3 days, completed na yung 10 days isolation from their mild symptoms. So pwede na silang mag-integrate into the community. So they can be without the need of further testing. So most of the time, hindi na kailangan magpa-repeat RT-PCR, but just as long as they can be cleared by a licensed medical doctor. Even if no repeat RT-PCR is done, at saka nasa-satisfy na to mga criteria na to. So thank you very much. So if ever for mga persons na merong may COVID, so you can have your vaccination because COVID vaccination is part of the solution. So you can have your vaccination 90 days after your COVID infection. And then, for the meantime, so as much as possible para makontrol natin ang COVID sa Philippines kasi sobrang dami na. So we have to wear mask lagi and don't remove your mask. Tapos, wear the face shield and don't touch your eyes, your nose, and your mouth. And then maintain a physical distance of 1 meter and as much as possible, stay at home. So to all those who have COVID, so I really hope and pray that all of you ay gumaling na at saka sana matapos na yung pandemic natin. Thank you so much for listening.